nurses historically have been reluctant to join unions, and they've certainly been reluctant to engage in strikes. But if you look at the statistics, the number of nurses joining unions has grown steadily over the last 10 or 15 years. And I think that's largely because nurses have realized that they can have a very positive impact on the workplace. They have a lot to say about patient care, but the only way they can get hospital administrations to give them a voice is by using their collective strength and by unionizing. In most cases, the most effective argument that nurses' unions use to convince nurses to join a union is that if they really want to do everything they possibly can to improve patient care, to take care of their patients in the way they've been taught to do so, then they need to gain a voice in the workplace. Nurses see themselves as patient advocates, and I think unions are effectively making the argument that to be the best patient advocates they can, they need to use their collective strength. When unions do organize nurses and when they do go to the bargaining table, what we see today is that nurses focus a lot of their attention on improving patient care, on giving nurses a greater voice in patient care issues. They focus on understaffing, they focus on mandatory overtime, on floating practices, all of which prevent them from providing the most effective patient care. So while nurses historically have been reluctant to go out on strike, particularly about wages and benefits, because they see that as selfish and self-centered, if the issue is how can they use their collective strength to improve care for their patients, then they are willing to do so. They're willing to go out on strike. And as I say, most strikes we see today are over issues like staffing. And in that case, nurses believe that they are really not only fighting for gains that are going to help them, they think they're fighting for their patients as well. And I think giving nurses a greater voice in the workplace probably is an effective way to improve patient care and actually to have a positive impact on the American healthcare system, because no one knows more about the day-to-day care of patients, and I don't think anybody cares more about the care of day-to-day patients than RNs.